Okay, good afternoon, folks. This afternoon's topic B title is Why the Number of Young Caregivers May Increase. Okay, here we go with today's discussion B for you. The article points to several structural pressures that could push even more caregiving onto children. Proposed Medicaid cuts. States are bracing for potential reductions in federal Medicaid funding if cuts occur. Home and Community-Based Services HCBS, which help elders and disabled adults remain at home, are among the first programs likely to be reduced or eliminated. Estimated 5.4 million U.S. children providing care to an adult in their household. These kids are helping with tasks that would normally fall to trained adults, managing medications, assisting with mobility and bathing, handling household responsibilities, coordinating medical appointments, providing supervision and emotional supports. Rely on the only available caregivers left at home, their kids. What role reversal means in this context? The story uses role reversal to describe a situation where children become their caregivers for elders rather than the other way around. The article illustrates this through the experience of Josh Yang, who became his mother's primary caregiver at age 15, after she developed Parkinson's symptoms following a car crash. He is one of an immediate support adults can offer and practical referral pathways. The article explains that millions of U.S. children and teenagers are already caring for aging or disabled family members, and that number is likely to grow sharply as states face potential cuts to Medicaid funded home care services when paid aides disappear or hours are reduced. Families often have no choice but to rely on children, folks. Okay. Deadlines or a trusted adult checking in can be transformative. Policy models with adapting The article points to an international examples, especially from England, where school-based identification dedicated young career coordinators and charity partnerships provide a safe net the U.S. currently lacks. If you'd like, I can turn this into a one-page screen-ready handout. Schools, youth programs, or caregiver support groups highlighting signs of youth caregiving. Okay, the piece gestures toward solutions that could make a meaningful difference. Recognition and screening. Schools, pediatricians, youth programs, and community organizations should ask gentle, structured questions to identify caregiving responsibilities early, connecting kids to supports, counseling, tutoring, respite services, peer groups, and community-based programs that can reduce the emotional and academic burden. Even small interventions like flexible homework, long-term services remain underfunded. Kids kids step in because the alternative is no care at all. Cultural silence. Many children do not identify themselves as caregivers. They see their work as just helping, even when it consumes hours each day. This silence keeps them hidden from systems that could help. Practical implications and next steps suggested by the article. Broader drivers and risks the page points to. The rise in youth caregiving is not accidental. It reflects structural gaps, healthcare and social service shortages. When home health aides, respite programs, and Medicaid funded supports are unavailable, unaffordable, or cut, families often turn to the only remaining resource, their children. Economic pressures. Many families cannot afford paid care, especially as medical costs rise and difficulty concentrating. Some kids fall behind academically or disengage socially because they're exhausted or preoccupied with responsibilities at home. Invisibility and lack of support. The U.S. has no systematic way to identify or assist young caregivers, unlike countries such as the UK, where schools and social service agencies proactively screen them or for them. The article underscores a central truth. We can't support what we do not see. The article makes clear that youth caregiving is not just a family issue, it's a public health and educational concern. Emotional and mental health impacts. Young caregivers experience higher rates of anxiety, depression, and chronic stress. Many feel isolated, guilty when they can't do more, or terrified of what might happen if they make a mistake. Educational effects. Caregiving, caregiving often leads to missed school days, incomplete homework, how the story is told. The article draws heavily on reporting by Fay Lynn Lewis for The Guardian, weaving together vivid narratives. A child who became a primary caregiver at 11, teen who cared for his father after a stroke, and others who describe the loneliness of carrying burdens their peers cannot imagine. These stories make the scale of the issue feel personal and urgent. Key consequences the page highlights. Disability or relatives recovering from injury or addiction. What do? Their responsibilities go far beyond helping out. Many perform hands-on medical and personal care tasks, lifting, transferring relatives, managing feeding tubes, administering medications, helping with bathing and toiletry, monitoring symptoms, and coordinating appointments. They also take on adult household roles, cooking, cleaning, supervising younger siblings, and managing finances or paperwork when no one else can. What the article describes in plain language. These young caregivers are not a small or niche group. They are ordinary kids living extraordinary circumstances. Who are they? Children as young as 8 or 9, adolescents balancing school with caregiving, and teens who become the de facto adults in their households. They care for parents with chronic illness and grandparents with dementia, siblings with disabilities, folks. I thought this would be interesting to do for the show because it happens to a bunch of families in the US, and I thought that it would bring some of it to light for you folks. I will be back on with C shortly. Give me a bit to put that together for you, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.